the station that's on your side. This is Channel 7 News Daybreak.
Well, you may have heard about an increase in norovirus cases. It's a highly contagious virus. Sometimes we call it the stomach flu. So today we have with us Baptist Health Dr. John Allen Cockrell with Sherwood Family Medical Center, and he's going to tell us all about the norovirus and how to stay healthy. So we were chatting about it. Yeah. It's viral. It's kind of like if you're going to get it, you're going to get it. There's no vaccine. So what symptoms come along with the norovirus, and what is the best way to handle it?
Yeah, so norovirus is not anything related to corona, right? It's been around for forever, right? So initially even studied in the 1960s. Some people know it as the Norwalk virus because it was studied in Norwalk, Ohio, of all places. So it comes by different names, but bottom line, it's gastroenteritis. That's what it causes, right? So this is stomach flu, so to speak, and I think we can talk about that in a second, but nausea, vomiting, sometimes violently, right? The diarrhea aspect and the loose stool, abdominal pain, fevers, chills, those things. So gastroenteritis, kind of the typical, I guess, stomach bug, GI symptoms. But the things to really watch out for, we're talking about, you know, before we got on here, the hydration of things, right? Right. Those that are young, so babies, young kids, you know, older adults, right? Those that are immune compromised, right? Really got to watch the hydration there because dehydration is going to be a significant factor here.
So what do you do though when, like, you have a baby, for example, who is just continually vomiting up formula or breast milk? And you continue, you know, you have to rehydrate them, but they continue to bring it back up. So do you just keep pushing those fluids, or what do you do?
Well, it can be scary, right? Yeah. And you were attesting to that too.
Yes.
I mean, I've got my wife and I have 2 kids. I mean, it can be scary. Yeah. So you know, you don't want to just unnecessarily force, you know, fluids, but things that you're looking for would be like urine output. Right? Especially in babies, right? So urine output, stool output, skin turgor, so the tightness of the skin, things like that. So babies are typically going to show, hey, we're dehydrated here. If you're unable to keep fluids down, it's not really worth forcing them down. At some point it becomes a medical issue that needs attention from a doc, right? So if you're unable, if your child, if your baby especially is unable to keep fluids down, it's important to take them to the doctor because there may be other ways to get nutrition, hydration, even IV if it comes to that, right? As opposed to just forcing fluids. So certainly if you're concerned out there with babies, but not just babies, kids, adults, this is something that affects everyone, but specific to your question, you know, at some point it becomes an evaluation necessary for hydration purposes.
So check the output.
Yeah, absolutely.
And if that's decreasing, then it might be time to head over to a physician and get some care. All right, well, thank you so much. It's Dr. Cockrell. Thanks for joining us this morning, and you can contact Baptist Health by going to baptist-health.com or calling the Baptist Health line at 1-888-BAPTIST.